Hello, everyone, and welcome to today's webinar, Mental Health in the Military, How to Cope During COVID-19. This is a part of our Coping with Coronavirus webinar series, where each week our mental health experts are sharing their knowledge and other resources on topics, including finding balance and managing expectations, preventing loneliness and isolation, stress management, and more. You can actually find a list of all of our upcoming and on-demand webinars at jcmh.org. A little bit about Jefferson Center. We've been serving Jefferson County, Clear Creek County, and Gilpin County for over 60 years. We are a nonprofit, community-focused mental health care and substance use services provider, and we offer hope and support to individuals and families who are struggling with mental health issues and substance use disorders. I'm pleased to introduce today's speaker, Kyle Alcorn, the Jefferson Center Veteran and Military Family Services Outreach Specialist. But before I hand the mic over to Kyle, I have a few housekeeping items to cover about this presentation. First, today's webinar will be available on demand after the live session, and we'll email that out to you. And we'll also have today's slide deck available. For the best viewing experience, please keep your microphones muted and turn your video during presentation mode. So you'll want to mute your microphones and turn off your video during the presentation. And you'll also want to change your Zoom view to speaker mode. Next, we'd love to hear from you during the presentation. If you have a question for Kyle, please feel free to send it through the chat at the bottom of your player. We'll be answering questions at the end of the session, and if we don't get to your question during today's webinar, we will be sure to follow up afterwards. And last, we'd like to encourage you to follow us on our social networks and share the recording of this webinar and other information about Jefferson Center. And so now, without further ado, I'd like to kick things off by welcoming Kyle. Kyle, over to you.
Awesome. Thank you very much. And thank you everyone who is here today in person. Well, kind of in person. For those of you who don't know me, I do work on our Veteran and Military Family Services team. A lot of my job is helping new folks connect to JCMH for veteran and military focused mental health care. I do some community suicide prevention work as well. And yeah, I guess we can just kind of take it away and I can tell you a little bit more about myself and give you an overview of where we're going to be going today. The title for today's webinar is Caring for Veterans in the Time of COVID-19. For our agenda, I have introductions plural. It's actually just going to be introductions since I'm basically going to be presenting and this won't be conversational. We're going to talk about some general mental health concerns in the times of disasters. And then we might take a little bit of time there to note how those touch uniquely on veteran and military populations. Then we'll look at some of the unique situations that come up just during COVID-19, like quarantine and isolation, things like that, and talk about how those have impacted or might impact military and veteran clients. And throughout, we're going to be looking at ways that we can leverage military and veteran clients' strengths based on their experience in the community. And at the end, we will have also some resources if you have clients in mind that you might have come to this presentation for that are local in the community. And then we can also field any questions that come up. We're going to hold them to the end, like as we said. Just go ahead and hang them in the chat, and we can revisit them as we need to at the end. So our singular introduction, again, my name is Kyle Alcorn. Here at JCMH, I am the Veteran and Military Family Services Outreach Specialist. I'm also an MSW student at University of Denver. My focus there is mental health. I've also been lucky throughout that time to serve in an Army Reserve behavioral health unit. So I've actually had a lot of visibility on military mental health practices and being able to see some actual client clinician work in a military setting. And this year, in addition to working at JCMH, I've also been doing counseling at an outpatient clinic in the VA that's oriented towards military sexual trauma and PTSD. Mainly combat-related PTSD, and then bereavement concerns for family members of fallen service members. That one always trips me up. My background prior to my social work journey, I spent 6 years on active duty in the Army in the infantry, which is sort of ground combat, what most people generally picture soldiers to be, gunfighting. I was a paratrooper, and then I spent time in our special operations forces. I deployed to Ukraine in support of our military and diplomatic goals in that country in 2016. And again, 2 years in the Army Reserve, focused on behavioral health. So moving on to our first substantive slide here, and I'm sure none of this is news to you all, especially if you're clinical staff here at JCMH, but we're going to talk about some general mental health concerns in times of disasters. Some that really jumped out to me just from doing a little bit of counseling work with vets at the beginning of this whole experience is checking in on their stress reactions. And by that, I mean really the DSM or diagnostic type stress reactions, short-term reactions to traumatic events, and then PTSD. One thing that's always useful to check in with clients is just how do the current situation, does the current situation with COVID-19 interact with any prior experiences of trauma? How might that exacerbate that? How might that open up reaction pathways that they already have? How might it be altering those in a problematic way? I know that for some folks in the military, it's very common to have some adverse reactions to leaving folks behind. And a lot of clients that I've worked with just over the last few months have had a lot of trouble with the social disconnect they've experienced in a not expected way. So that's been something to check in on. And with military folks, it might be something where you want to have a conversation around what their sort of mandatory moves in the military were like. If they were told to go from one base to another, if they had to deploy on an unexpected basis, if they had to come home from a deployment in a way that wasn't expected. How has that all sort of come up for them with really kind of similar situations in terms of COVID-19, the stay-at-home and safer-at-home orders? Grief and loss has been another big one that I've noticed working with vets in the community, whether it's in my community role here at JCMH or clinical role at the VA. And this is multi-tiered. For grief and loss, I've noticed a lot of vets, especially in older cohorts, they know people who are affected by the disease itself. So we're thinking in terms of what most people think of with grief and loss, death and dying oriented grief and loss, and really needing to attend to how people are able to interact with what they're grieving for. There's a lot of disenfranchised grief right now with folks who aren't able to attend the medical treatment of a loved one or a family member or a friend. In the military and veteran community, that gets to be very personal. You develop friends, coworkers, buddies in the sort of military lexicon who become family members. And I know for at least a few of the clients that I've worked with, it's been a very jarring thing that they haven't been able to go through these traditional prescribed steps of grieving before an event and after an event that's related to death and dying. Some of the other things that are bringing up grief and loss concerns are things not necessarily death and dying related. It's related to losses of experiences or routines or habits or just parts of their daily life that they enjoyed. Also just sort of grieving and recognizing the loss involved and needing to take on an entirely new pattern of life. That's been really disruptive, I've noticed, for older veterans who are maybe from Korean War and Vietnam War cohorts of veterans. They've developed very long-standing routines that have kind of been their stability and help process a lot of what they went through in terms of going to war and coming back. And now that's been completely disrupted by not being able to go to, say, a VFW meeting or a group therapy meeting, or being able to just check in with friends for coffee the way that they used to. These are some pretty big clinical concerns for everybody. And I'm not trying to say these aren't happening for everyone in the community right now, but for some veterans, these have become special concerns. And last bullet, we've kind of already talked about this. How have these disaster-oriented mental health concerns interacted with pre-existing concerns or stressors. And just having an awareness of that and knowing where that might lead, what might help, those have been pretty useful points for success in my clinical work with veterans recently. Normally I pause for questions at the end of each slide, but that's not happening. So we're gonna keep motoring on. So now a brief overview of some military and veteran specific concerns with COVID-19. Some of these look pretty general. We're gonna dive into them. This is more an agenda slide. I really want to spend the rest of our time talking a lot about isolation and quarantine and how that interacts with some sort of veteran population patterns, threat responses and triggers. That's a huge thing that should be a topic of discussion in clinical work with veterans, just because those phenomena are so different in veteran and military populations than with most civilian clients, for reasons that we'll discuss. And when I say potential activation or call to duty, this is talking about folks in our community, possibly clients, who are reservists in the National Guard. They're in one of these components of the military that perhaps is actually right now working with the coronavirus response. And then another thing that comes up consistently with veteran and military clients in any moment of national emergency, disaster, or warfare is feeling left out of the effort. It's oftentimes very hard for veterans to walk away from their role in the military, and this is a consistent issue when it's situations like this come up. They're trained to want to help. They're trained to want to be on the literal front line. And that's a major clinical concern working with them, because it creates a lot of distress and anxiety when they see that this role as a responder maybe isn't there in the same way it was before. So moving into the first concern here for veterans, isolation. I've noted here that many veteran clients already experience some degree of isolation. This is driven a lot by the fact that they've had to really transition roles. Or if you're a military client, you might not really connect with civilian society in the same way. So if you were to see a clinician here at Jefferson Center, there might be a lot of disconnect in the initial sessions about how much of that service member's experience is understood. And there's just a lot of need for curiosity and exploring that, setting up a common vocabulary. But I've noticed this isolation, it tends to be very, very much distinct in Korean War and Vietnam War vets as they get older. They've lost a lot of the folks that they can really personally relate to about their experiences. And a lot of them are very averse to formal mental health care just because of what the experience of mental health care was like in the immediate aftermath of their military service. This is often seen, the patterns of isolation, as a negative, as a risk factor for a lot of mental health issues. Right now, it's actually interesting to have conversations with clients about how this might actually be a strength. A pattern of isolation and having adaptations to living alone or separated from a lot of folks around you is something that veterans could probably lend themselves to as experts in a way. So that's been an interesting conversation for me in session with clients, whether it's been telehealth or in person at the very early stages of this, is how might veterans help their family members, their neighbors, perhaps even their therapist, if their therapist is wondering how to live alone. This could be a real big issue, a real big area of strength, and a way for veterans to perceive some self-efficacy in the middle of this big time of ambiguity. With veterans, I'm sure I'm not surprising anyone in the room here. Suicide is a very large concern of epidemic proportions in the veteran population. The statistic that a lot of people like to talk about is that one veteran every, I believe, 22 minutes dies by suicide. It's very frequently. It's disproportionate. And right now, with the pattern of isolation that's going on for everybody, assessments for suicide need to be frequent, revisiting safety plans, anything like that, developing an awareness of any new risk factors that are popping up, and continuing to check in on protective factors. One thing specific to the veteran and military population is their access to and comfort with the most lethal means of completing a suicide, which is firearms. A large proportion of veterans own firearms, and right now they are isolated in their houses, perhaps more than normal, with those firearms. So being comfortable having conversations about safe storage, perhaps even out of the home safe storage options, those are really critical for veterans right now, just because of how different this situation is and how cooped up folks are with risk factors or means or things like that. Moving on to another concern with isolation, resources and services are disrupted a lot right now too, whether that's from the VA system or community-oriented nonprofit resources that assist veterans. This has been a very important part of the work I've been doing, is just making sure, are you still connected to any resources that are keeping you going through the day? Have they been disrupted by the disaster? Have volunteers been able to keep working? Have materials been able to be delivered? And we'll get, at the end of the presentation, I do have a kind of short list of places to go for some of the most common resource issues that I've seen popping up with veterans in the recent months here. And I know it's difficult right now, but on my last bullet there, identifying appropriate pro-social opportunities. This is a consistent clinical concern with military and veteran clients, just since there are kind of prevalent patterns of self-isolation, and especially in the immediate aftermath of transitioning out of the military, a lot of trouble connecting to new opportunities in civilian communities. So I have two resources that are virtual here that have quarantine-related resources, social events via platforms like Zoom. I think that they're very good quality resources. One is called Warrior Now, which is a local nonprofit that works broad-based on a lot of issues with veterans. Another is called Rally Point, which is a really popular social networking and information site oriented towards veterans that also has some mental health resources and peer connection ability too. Moving on, our second concern here that really has jumped out to me in terms of how military and veterans interact with events like COVID-19 and the pandemic is threat response. If you've been in the military, even if you're out now as a veteran, you have developed very different threat perception modes and very different threat response capabilities or patterns. And for a lot of folks, we picture the fight, flight, or freeze continuum. In the military, you're trained and socialized to being very comfortable at the fight end of that spectrum. And that's a very positive adaptation in a military environment. Your job is literally fighting and keeping others from defeating you in a fight. So it's kind of a difficult transition though for folks who are out of the service to move a little farther along that continuum. So understanding where your clients are on this continuum of fight, flight, and freeze is very useful to understanding how they might be perceiving things in the media, or talk with folks in their neighborhood or with their family about this new, very ambiguous kind of threat in COVID-19. One of the first places I always go to is just having a very honest conversation about how safe someone feels, and really how safe someone feels. Asking, how does this affect you? How has this not just affected your personal safety? How has it affected your bottom line? Are you out of work right now? How much of a threat is this to you and the way you live? That will let you know a lot about whether traveling back to this fight end of the continuum that we've been talking about is a likely thing for the client that you're working with. I think it's also useful with veterans to look for reframes or adjustments. A lot of times in the media, there's a very big propensity to kind of look at veterans in a way that they might be broken, or their adaptations don't work, or that they need to leave behind an adaptation from their time in service once they're a civilian. And I genuinely do not believe that. I think that you can look for reframes or adjustments and leverage these as strengths for your clients who have military or veteran affiliations. In terms of threat response, it could be something like looking out for their friends, checking on your buddy is a big metaphor or saying in the military. You always want to check in military lexicon with the person on your right and the person on your left. I realize that's going to be mirrored and not right in Zoom. I'm sorry about that. So, I mean, just making that could be a way to get them connected to pro-social activity too, is framing their threat response and their response to this new scary time as an opportunity to check on perhaps military and veteran friends. Perhaps it's neighbors that they've developed a relationship with. It really is a genuine strength of military folks that they have a strong commitment to looking out for other people and making sure that the people they care about are in the best situation possible to meet ambiguous scenarios. That's just one of the many reframes or adjustments you could make. Some of it is also just going to be processing. How is this threat different from the threats that you were trained or socialized to in the military? And those are genuinely fruitful conversations, in my opinion, based on the work that I've done. And I come back to this idea of feeling left out of the effort. So when folks in the military perceive a threat or an event that needs a response, it's really common to have a lot of feelings of disappointment. Perhaps, I don't want to say self-hatred, but a little bit of disappointment that they can't be part of the effort. And this has been something I've noticed with military clients, veteran clients, in terms of traditional military type disasters. So if a headline comes up where there's been a terrorist attack or a military engagement somewhere else, veteran clients always want to see how close can they get to getting back to that activity. And this is another place where I would redirect or look for opportunities in the community to help the community response to this very different type of threat. You can't shoot back at COVID. You can't do most military tasks with COVID, but you can do a lot of constructive things in your community, whether it's volunteering or taking care of loved ones in a safe way in terms of epidemiology. That would just be another point where I might have that conversation with folks if threat response and feeling left out of a collective effort are a concern for a client of yours. One thing I want to touch on, since we do work with folks living in our community who are in reserve units, they might even be in an active unit if they're at an installation like Buckley out in Aurora. There's a very real chance that people are being activated right now in our community to be part of the coronavirus response. I mean, it's already happened, but it could happen to folks who it hasn't already happened to. And that brings up a lot of clinical concerns, case management concerns that you might have. And I'm not leaving it hanging. We will get to that in the end with the resources slide. But this is something where if you have a client that is going to be perhaps going to another state or another part of this state, or maybe working long days away from home, there's a lot that's going to go on there. This is basically pre-deployment counseling for clients when you might not have expected that to be part of your duties at Jefferson Center if you do have such a client. A lot of that is going to be attending to a family system. Is there a plan for continued communication and connections with a service member's family system while they're going through this incredibly stressful ordeal of responding to a disease? Is the family system attended to in terms of case management? Do they have all the resources that they would need to succeed while their service member might not be able to help them if they're called up to duty? Another concern for folks who are on active duty military service is the subject of mandated moves or permanent changes of station. In military jargon, that's PCS. This is when the military says, okay, you've done a great job at the base you're stationed on now. it's time for you to move, and you're going to go work somewhere else for a few years, gain some new experiences, and learn some new ways of doing things. Right now, because of COVID-19, that whole process is disrupted worldwide. And this is creating some pretty big resource and case management issues for military folks everywhere, in every branch of service. It's created a pretty frequent situation where service members have gone to the trouble of buying a house in the new place where they anticipated moving, and now they can't move there. The military has barred them from moving there. So a lot of folks in the military are very resource strapped because they're managing this sort of dual household scenario where they need to pay the expenses of where they're living and where they expected to live in the future. And there are some emergency resources available for that through the various military services, but that's another that could be another very serious concern. It could create a lot of distress for clients, and it's something that I've had to experience in clinical work already. And then the bullets are a little jumbled here. The secondary trauma concerns probably should have been up one more with relation to potential activation or deployment. A lot of folks right now are being activated for coronavirus response that perhaps didn't expect to be involved in a virus pandemic or a medical response role, but that's the way the military needs to use them right now. And they might not have any training or any sort of organizational or institutional awareness of secondary trauma through their training as soldiers or whatever other variety of service member. So that would be a very valuable conversation to have as well, is preparing them for interacting with potentially traumatic or disturbing scenarios. If they have to work with first responders, anything related to people suffering from the disease, that could bring up some serious secondary trauma issues if they're involved in a lot of death and dying that they weren't expecting. And there are a lot of issues with minimizing non-war zone death and dying in the military and veteran community. And that would be a very interesting clinical conversation to have, is that all the ancillary concerns about death and dying are just as real in non-gunfight scenarios as they are in a domestic medical environment here in the US. Moving on, here we are. I've been talking about them the whole presentation. Some community resources that I think I've interacted with each of these resources myself. I think they're very effective for a lot of veteran clients. And I can tell you a little bit about each of them. My Zoom bubbles here are blocking out some of the logos, but the first one I wanted to talk about is Warrior Now, and they're a local group here in Colorado who they're focused on just about everything veterans can interact with. They put on pro-social activities. They help with issues of homelessness and housing. They are involved pretty heavily in local justice system diversion courts for veterans, where veterans can have deferred sentencing or probation options based on their veteran status if they participate in case management and probation through the court. Warrior Now also does really cool virtual events right now in the pandemic to try to help do anything to keep people connected to their community and other veterans, and just sort of help veterans mentor one another. I've had clients from ages 25 maybe up through their 60s and 70s that have loved these virtual events. A lot of them are done by Zoom. Some of them are by Skype or by telephone, but they've had movie nights, they have socials, they have speaker series that are oriented towards military and veteran topics. And don't worry if you don't have the contact info. I have another slide directly below where I'm going to give you URLs or phone numbers for these, but very worthwhile to go to their website, check out their quarantine resources, check out any upcoming events they have, or refer your clients to do that. For housing, if veterans are not connected to VA housing services, Volunteers of America is really the forefront of veteran homelessness solutions here in Colorado. Their big sort of hub is at the Bill Daniels Center, which is down on Santa Fe near downtown. And they have a whole range of programs for housing for vets and also for folks who aren't military affiliated, but for the purposes of this presentation, we'll focus on that. They can help connect veterans with immediate housing needs. They can help connect them to transitional periods in a hotel solution or a similar facility. And then they also collaborate with the VA to develop long-term housing solutions that are a little more permanent. For peer connections, I have it labeled as peer connections, but it's really multi-purpose. Rally Point is a really cool both website and app, so you can access it mobile or on a computer. It started out as kind of a forum for veterans where it was really informal, almost like Reddit. And then they started partnering with other very large nonprofits and government agencies related to veterans to help allay some of the concerns that popped up in their forum boards. I know connecting folks with mental health treatment was a big thing when suicide became a pretty frequent issue on the message boards. So they actually collaborate with the VA mental health services right now to connect folks to responsive services in their community and sort of virtually or nationwide. They also do some career coaching. They do virtual hiring events, which is very important right now with people having lost traditional employment opportunities. It's also just kind of a cool place to go to hang out and spend some time if you have a free day during quarantine. Sign up is pretty easy. It's free. You can talk about anything you want. You can try to connect with old friends or find out what they're doing. You can see what's going on in the military right now. You can see what's going on in your community. And obviously, it would be somewhat irresponsible to not mention the VA itself. A lot of our clients who are military and veteran affiliated here at JCMH, they come to us through something called the Mission Act, which is basically letting VA clients or patients see community providers outside the VA system if there's some sort of structural reason that's keeping them from regularly engaging with treatment at the VA, like a drive distance or wait times at a specific clinic. So that's how a lot of folks end up with us at JCMH if they're VA affiliated. But what I really wanted to touch on, though, is that the VA has opportunities like all of the ones above for veterans who are eligible, which is another concern. So if folks have the right discharge category or they're already connected to VA resources, it's always useful if they have a housing concern, food, employment, anything like that. The VA is a great place to go for that. And for their medical appointments too. I know that's a big concern right now is that military and veteran clients, patients, wherever they are in the system, with non-emergency and non-critical procedures being delayed, this might be a point where if you're involved in a client's case management, it might be very useful to get to know who they work with at the VA so that there's someone else in the process of making sure that these appointments come back onto a schedule and that there's a plan moving forward, because that can contribute so much to a lot of the mental distress that veteran clients experience, especially, is frustration with the VA. I would hazard to guess if any of you treat a client in a therapy setting that's a veteran, frustration with the VA has likely been the topic of at least one session that you've done. Getting into the contact information for those, I'm going to leave this one up on the screen for a little bit, and I'll do a little more narration about some of the other resources here. We already talked about Warrior Now, Volunteers of America, and Rally Point. I've broken the VA into two separate portions. So if a client has a healthcare concern to include mental health that involves a clinical interaction, the best number you can give in Colorado, and well, Denver metro area, but a lot of Colorado, is the number that I have on the screen for the Rocky Mountain Regional Hospital. That's the large facility out in Aurora. Their phone number, as you can see there, is 303-399-8020. That's just a one-stop shop. They can connect you with just about any clinic or facility or clinician in the Eastern Colorado healthcare system for veterans. For VA benefits, so if you have a client that utilizes a disability benefit or an education benefit like GI Bill or vocational rehab, it's actually a separate part of the VA called the Veterans Benefits Administration. Their office is down in the Federal Center near Kipling and 6th Avenue. Um, their phone number right now, not right now, always, is 1-800-827-1000. And they have staff on call at that center to help with any veterans benefits concern. An additional resource, if you aren't used to working with veterans clients, Colorado and really every others has a system of what are called veterans services officers or veterans service officers. Their only job for a county government is helping veterans navigate their benefits and entitlements that are derived from their veteran status. Each county has one of those. I didn't have 64 slides to present that, but really the best way to track this information down is ask your client what county do they live in. For us here at Jefferson Center, that's very likely going to be Jefferson County or one of our mountain counties. And then it's very easy to find this information through a quick Google search if you just type in the county that they live in and the term Veterans Service Officer. And yeah, those are resources that I think can help with most things. One other thing about VSOs, they're often connected to a county level labor and employment office. So they can also help a lot with immediate employment needs. They're probably one of the best places you can go with a veteran client who's having an employment issue. That just about does it for the formal presentation portion of the slideshow here. I wasn't paying attention to the chat function, but I'm very willing to handle or field any questions that you all might have.
Kyle, thank you so much. We did get a couple of questions.
Cool, let's get them.
So our first one is, so this one's actually from someone who is a veteran, and they were asking, I've been managing pretty well with this whole situation, but I've dealt with anxiety and depression in the past. How do I know when I should seek help versus just kind of everyday issues?
So I guess where I would come from with that is seeking help can come in a lot of different ways. It doesn't always have to be a clinical interaction, which I think is probably where we're going with the question. If they want to type in and clarify, they totally can. I think right now it would be important to seek help every day, whether it's just sort of giving yourself what we in the mental health sector like to call self-care. That's probably your first line. If so, looking at it from a veteran perspective, that would be your self-care if you were in a casualty scenario. Patching yourself up a little bit, knowing what makes you work through the day. And it sounds like you already have some ideas about what works for you. When I would look into maybe escalating that to someone like Jefferson Center or perhaps even like a veteran group that works with people who are experiencing distress and are in the military and veteran community, is when you start noticing significant changes in your daily pattern of living. Are you having more trouble getting up and going for the day? And I know we're in the pandemic, that's different for everybody, but are you noticing that it's harder for you to do the things that you normally do, that you like to do, and that you're able to do? That's when I might start seeking out somebody to just have a talk with. And it can be as simple as that. I know that mental health treatment is it's scary for folks who have been in the service, because in a lot of ways that's a quick ticket out of a career that you love, as if you have the wrong kind of mental health involvement. That's the perception anyway. But really, one thing I try to communicate to every veteran that I work with, whether it's in the community or in a clinical role, is that if you can get it to the point where you can just make it through the door, therapy and talking to someone is nowhere near as scary as it once seemed when you were in the service. It's really liberating to let some of these experiences out. So yeah, I'd say once your pattern of living changes, that's when I'd seek help. I would especially seek help if you are having any thoughts of harming yourself or others, or if you literally just do not feel safe for another reason. That is one time where I would immediately advise someone to seek out help. And I'd be happy to have anybody else unmute and chime in too if they feel like there's something I left out.
Okay, Kyle. So our next question is, I have a good friend who could really benefit from a lot of these resources, but I'm not sure how to bring this up since it tends to be a touchy subject. How would you recommend that I help my friend while being sensitive to her feelings?
One way that I've found that, and I'm just thinking back to my time in the service before I've kind of moved into this new role in formal mental health care, I'd always try things out on my own. If I learned about something that I maybe didn't know about or that people might be reluctant about, if I was going to recommend it, I would always try it. And I feel like that's a pretty native feeling for folks in the military because there's a very big ethic of not asking people to do the things you yourself are not willing to do. So I don't know if the question asker, not sure if that's the right term, was in the military themselves, but I would broach it as, hey, I found this cool new resource that helped maybe myself or someone else that I know. I'm thinking maybe it could be useful for you too. That would be one pretty low threat way of bringing that up. Or there's also if you're worried about how the conversation might go, you might just print out maybe like a home page or a contact page or a description and just leave it somewhere where they might find it. A lot of times that takes away the perception that someone else is telling you to get into therapy or telling you to get into a mental health resource. It leaves the decision up to you, which is um, honestly pretty constructive.
Great, thank you. And then one final question. This was also from somebody who her husband is a veteran, and it's just the two of them at home, and she wants to know what are some ways that I can help him.
I think, okay, I think one thing that would probably be very helpful is just right now, one thing the pandemic has done with people going home is their routines and the things that keep them going are gone. And I'm sure I'm not giving anyone any new information by saying that. But finding things, whether it's for bonding or stability or routine, finding new things that you can add into your day during this weird time is very useful, whether it's like a standing meal time, or I know one thing we've enacted in my house every day, we go and use the fire pit and we have time where we talk. um, those sorts of things, like those are actually military and veteran related things you recommend for folks who are going on deployment, and that's why I think that they're very useful right now, because people who are entering into the pandemic are understanding a little bit about what it's like to be in the service and approaching sort of a what we in the military or the veteran community would call a threat environment, where there's a lot of ambiguity, and having traditions, check-ins, routines, things that you come back to every day that give you that stability and safety. That's what I would recommend. I don't know what exactly would look great for you personally, just since I haven't met you before. Um, it could be trying to find a way to bring something back that was lost through the pandemic. Like maybe you went out for dinner every Friday night. That could be an opportunity to start a cooking night or something like that. I would say if you're worried about safety though, or anything like that for the veteran that you're living with, I would definitely just keep in touch with Jefferson Center, and safety along a spectrum. It can be they're in psychological distress, they're experiencing depression. It could, if they're farther along at a point on that spectrum, it could be calling to find crisis services, and that's a resource I didn't involve in the slideshow here. Colorado Crisis Services is a wonderful resource, and it's not just for the crises that a lot of people think of. You can you can just be at the end of your rope and not knowing how to cope, and that's what crisis services is there for. I believe their phone number, I'm going to look it up right now since I didn't put it in the slides, and I want this person to be able to hear this while we're on the webinar. Um, I believe it is 1844 493 8255. So again, that's 1844 493 8255. That's just a great place to go if somebody feels like they don't have anybody to talk to in any circumstance. And yeah, I hope that that was complete enough. I feel bad if it wasn't. Sorry.
No, that was a really great answer. Thank you. I think those are all of the questions we have. So, Kyle, I just wanted to thank you again for your time. And thank you, everybody, for attending our webinar today. Please know that Jefferson Center is here for you. And through the good times and the bad, we'll be here with you every step of the way. We are open and accepting new patients via phone and telehealth appointments. And we've adapted to the current situation by developing innovative ways to provide remote care, ensuring that no one falls through the cracks during this time of uncertainty. You can visit our website at jcmh.org or follow us on Facebook for more resources and information. And you can also reach us by calling us at 303-425-0300. That's it for today. And thank you, everyone. Have a wonderful afternoon.